Ever imagine, like, being a doctor facing a patient really struggling to breathe, and traditional oxygen therapy just isn't enough?
Oh, yeah,
Scary, right?
definitely.
That's where high-flow oxygen therapy comes in, HFOT. Potentially the difference between a ventilator and, well, breathing freely. Today's deep dive, we're going into that world, the world of HFOT, based on this blog post. From the Society of Mechanical Ventilation, the title, High Flow Oxygen Therapy, HFOT. We need more.
Getchy.
It really is. A peek into a rapidly developing field, all those areas just ripe for innovation.
Exactly. It is really fascinating stuff. HFOT, it delivers warmed, humidified oxygen and a much
Yeah.
higher flow rate than a simple nasal cannula.
Right, right.
But the thing is, there's still a lot we're learning about it.
Ah, okay, so that's where the we need more comes in.
You got it.
All right, so before we get to the more part, break it down for me. How does HFOT actually work? I mean, for someone who's not a, respiratory therapist.
Sure, sure. So think of it this way. Instead of just blasting cold, dry oxygen, HFOT is different. It creates this comfortable, humidified stream, way easier for the lungs to absorb.
Okay, that makes sense.
And that higher flow rate
Yeah.
helps keep the airways open, improves the overall ventilation.
So it's not just about more oxygen, it's about how it's delivered.
Yeah, more effective, more comfortable for the patient. Makes a huge difference.
Absolutely. But you said we're still learning about it.
We are. This blog post, it highlights that need for more research to really fine-tune the therapy.
Gotcha. So that's we need more.
Precisely. And the author
Mm-hmm.
seems like a real HFOT enthusiast.
Yeah.
Outlines these key areas where advancements are needed.
Like what? Lay it on me.
Well, monitoring's a big one, a
Mhm.
really big one.
Right.
Right now, we rely heavily on oxygen saturation levels. You know that little clip you always see on people's fingers in the hospital.
Yeah, know exactly what you mean.
But this blog
Yep.
emphasizes going beyond that.
Meaning, what else do we need?
For one thing, we need better ways to track the pressure, the actual pressure delivered during HFOT.
Oh, okay.
Like, think about inflating a tire.
Okay.
You need to know the pressure's right,
Hmm.
not just that air's going in.
Got it. So making sure the oxygen is reaching the lungs.
With the right force.
Right. What else? Another crucial factor, measuring end-tidal CO2.
And tidal CO2.
Basically tells us how well a patient's expelling carbon dioxide. Key to understanding how well their lungs are ventilating.
Got it.
And ideally, knowing the patient's inspiratory flow would help. How much air they're drawing in with each breath allows for more precise adjustments to the flow rate of the HFOT system.
So we're talking about moving beyond one size fits all.
Exactly. It's about tailoring the therapy to each person's needs.
I like that personalized touch. What else are we looking at?
Let's see. Another area ripe for advancement, delivery modes. You see, traditionally, HFOT is delivered through nasal cannulas, but the author's suggesting we explore other options. Really? I'm picturing some, futuristic oxygen mask.
Well, the mentioned tracheostomy tubes for
Oh,
patients who need more, intensive airway support.
Okay.
And even non-invasive masks.
Yeah.
Maybe more comfortable for some than those nasal cannulas.
Yeah. It's all about finding the most effective way to get that oxygen where it needs to go, right?
Yeah. And keeping it comfortable, too.
It makes a huge difference. Okay, what else is in this? We need more. Plea.
Humidification. A key one. And this is where it gets really interesting because, it's important to keep those airways moist.
Yeah, of course.
But the author raises this question. It's thought-provoking. Could too much humidity actually backfire?
Really? Too much of a good thing.
Right. Think about it this way. The goal,
Mm.
to get oxygen into the alveoli, those tiny air sacs in the lungs,
Right.
where the gas exchange happens.
Yeah.
If those airways are, overly saturated with water vapor, it could dilute the oxygen concentration, make it harder for the lungs to do their job.
Ah, so it's finding that sweet spot. Enough to prevent irritation, but not too much to hinder the oxygen.
Exactly. And it's definitely an area where more research is needed to determine, the optimal level of humidification
Yeah.
for different patients, different situations.
Yeah, of course. Makes sense. I'm sensing a theme here.
Oh, yeah.
Personalization. It's all about personalization.
Definitely a running theme here.
I also noticed the author mentioning device variation.
Oh, absolutely. Not all HFOT machines are made equal. Some have, more sophisticated monitoring. Others might be better at humidification control or flow rate precision.
So it's about choosing the right HFOT system. Not just any system, but the right one for that specific patient. and their needs, like picking the right tool from your toolbox.
Exactly. And this is where things start to get really futuristic. The blog post talks about smart HFOT machines
Hmm.
powered by, you guessed it, artificial intelligence.
Hold on. AI-powered oxygen therapy. That sounds straight out of Star Trek.
It does, doesn't it? But the potential is huge. Like having a mini expert at the bedside, 24/7. AI could analyze the patient's data in real time, fine-tuning flow rates, adjusting humidity, even predicting complications.
Hold up. AI that can predict complications. That's mind-blowing. Is this real? Or are we in science fiction territory?
Well, the technology is there, advancing rapidly, and the possibilities are really exciting. But of course, with any powerful tool, we need to proceed carefully.
Meaning, what are some of the, challenges?
Well, first off, these AI algorithms have to be super reliable, accurate. We're talking life-saving therapies, so the stakes are high, really high.
Right. Can't have AI making those kinds of decisions without being absolutely sure. What else?
Another challenge, making sure these smart devices are truly personalized. We don't want to make existing health disparities worse.
Makes sense. Everyone needs access, and those algorithms can't disadvantage certain patients.
Exactly. These are just a few things we need to think about as we, delve deeper into this AI-powered HFOT world.
It's a fascinating landscape, complex too. But this blog post, it's really opened my eyes. Incredible potential. But the ethical considerations too. Really important stuff. Anything else in the blog?
The comment section was really interesting.
So what did they say?
Seems like the author's call for more research resonated. With other medical professionals, they had some really insightful comments.
Like what? Give me the highlights.
Well, one commenter, Doug Petzinger, specifically mentioned needing better ways to measure CO2 clearance during HFOT. He even suggested using something called TCP CO2 monitoring.
TCP CO2, that's a mouthful. What is that?
Stands for transcutaneous CO2 monitoring. It's non-invasive, measures carbon dioxide levels through the skin, can be more reliable than other methods, especially for patients on HFOT.
Interesting. So really fine-tuning the monitoring. What else? What else did those commenters bring up?
Another commenter, Stephen Tunnell, he highlighted matching the HFOT flow rate to the patient's inspiratory demand, how much air they're actually trying to breathe in. If the device can't keep up, could be problems. Inaccurate oxygen delivery could even be dangerous.
You wouldn't want the machine lagging behind while the patient's struggling. It's got to be in sync, right?
Exactly. Like a dance. And he emphasized humidification. HFOT systems without built-in humidifiers need to be managed carefully.
Right. We don't want to overdo it, but we can't let those airways dry out either. It's about finding that balance.
Absolutely. I think these comments really highlight the need for more research and development for HFOT.
A hot topic, for sure. So much to explore, so much to improve.
It's true. And this is an area where we're seeing rapid advancements.
So it all comes back to that title, huh? High-flow oxygen therapy. We need more. More research, more innovation, more collaboration. Sounds like we're just at the beginning of this HFOT story.
I think so. This is just the tip of the iceberg.
Okay, before we get too far ahead of ourselves, let's take a breath. Key takeaways from this blog post. What should our listener really understand, walking away from this deep dive?
Well, number one, HFOT is a game changer. It's got the potential to really transform how we treat respiratory failure. It's more comfortable. And it might even help some patients avoid ventilators.
Wow, that's huge.
It is. But like we've been saying, there's so much more to learn to improve.
Refining those monitoring techniques, exploring all the delivery methods, and, harnessing technology.
AI. Can't forget AI.
AI. To optimize this therapy, make it even better.
Exactly.
Exciting to think about. But for now, let's focus back to those specific areas for improvement from the blog.
Sure. Let's start with monitoring, going beyond just oxygen saturation.
Right. We need to know how those lungs are actually functioning during HFOT.
Yeah. And that's where measuring things like end-tidal CO2 and inspiratory flow are so important.
Break it down for me. End-tidal CO2, that's how effectively the patient gets rid of carbon dioxide, right?
Right. It's measuring the carbon dioxide in the air they exhale at the end of each breath. If it's high, it could mean the lungs aren't ventilating like they should.
So it's a way of seeing how well the lungs are doing that gas exchange.
Exactly. Then there's inspiratory flow,
Oh.
how much air they're breathing in with each breath. Knowing that helps us tailor the HFOT flow rate to the patient.
So bigger breaths, the machine needs to deliver more oxygen to keep up.
You got it. If the machine's not delivering enough, problems. Big problems.
Right, like trying to fill a big bucket with a tiny hose is never going to work.
Perfect analogy. Shows why having accurate monitoring is so crucial.
Okay, So monitoring, we talked about that. But there are other areas for improvement too, right?
We did. Remember the delivery modes? The blog post suggested more than just nasal cannulas.
Oh, yeah. Tracheostomy tubes
Right.
and non-invasive masks. Pros and cons.
Well, tracheostomy tubes, those are for patients who need, like, a lot of support, more intensive airway support, often in critical care.
Okay.
They're really effective, but they need surgery.
More invasive, but sometimes necessary.
Right. And then there are the non-invasive masks. No surgery needed. And they can be more comfortable than those nasal cannulas, especially if you need them for a while.
So a good option for patients who need that extra help, but maybe not a tracheostomy tube.
Exactly. There's a lot of research going on right now comparing all these different ways to deliver HFOT to see what works best.
Wow, that's so interesting.
It is.
They really are trying to personalize it, huh?
They are. And that brings us to another biggie, humidification. Remember we talked about too much humidity potentially being a problem.
Right. Too much moisture in the airways, and it could actually make it harder to absorb oxygen, like trying to breathe underwater.
Exactly. And this is why we need more research to figure out that perfect amount of humidification during HFOT.
So not just about cranking it up, but finding that right level.
That sweet spot
Mm.
where the airways are moist, but it's not compromising the oxygen delivery. And technology can really help here. Some HFOT devices, they've got these really sophisticated humidification systems. Precise control over the moisture delivered.
Like a mini humidifier built right in.
Precisely.
Yeah.
And they can even adjust the humidity levels automatically based on what the patient needs.
That's amazing. Like climate control for your lungs.
It is. And it makes HFOT so much more comfortable and effective.
Okay, so we talked about monitoring, delivery modes, humidification.
Yep.
What else did they say needs improvement?
Oh, yeah. Remember we talked about how not all HFOT devices are the same?
Some have more features than others.
Right. And the author really emphasized the need for research to understand how these different devices actually perform.
Yeah, I mean, you want to make sure you have a good machine when it's delivering life-saving therapy.
You do. And as technology keeps getting better and better, we'll see even more sophisticated HFOT devices on the market.
Which brings us to the part I've been waiting for. AI-powered HFOT. It's just like wild to think about machines that can learn and adapt to each patient.
It is pretty amazing.
Yeah.
Imagine HFOT devices that can predict those complications before they even happen.
That's straight out of a sci-fi movie.
I know. AI has the potential to change everything about healthcare, and HFOT is no exception.
Okay, so before we go down that AI rabbit hole, let's bring it back. Why should our listeners care? What's the big takeaway here?
The bottom line, HFOT is a huge breakthrough. It can really improve the lives of people with respiratory failure.
And we're only just beginning to tap into its potential.
Exactly. As researchers and clinicians keep pushing the boundaries, we're going to see amazing things in HFOT technology and how it can be used.
And that's what makes this so fascinating. It's like a peek into the future.
A glimpse into the future of respiratory care.
Now, the elephant in the room, AI, the blog post really highlighted it, the potential to take HFOT to a whole other level, but, those ethical considerations, right?
Oh, absolutely. With any powerful technology, we need to be careful. Make sure AI is being used responsibly, ethically.
So let's talk about that. What do we need to be mindful of, specifically when it comes to AI and HFOT?
Well, one thing, we got to make sure that these AI algorithms are developed fairly, equitably. We don't want to create a system where certain groups are, like, left behind or excluded.
AI should be promoting health equity, not making those disparities worse.
Exactly. We also have to be mindful of bias in these algorithms. AI is only as good as the data it learns from. If that data is biased, the AI is going to be biased.
So it's not just about building these fancy algorithms, it's making sure they're learning from good data that represents everyone.
Exactly. And that's a big challenge. Researchers and developers are working hard on that.
Okay, so fairness and bias. What else should we be thinking about? Ethically.
Transparency. We need to be able to see how these AI systems are making their decisions.
Right, can't just blindly trust it, especially when it comes to healthcare.
Exactly. And then accountability. What happens if the AI makes a mistake? Who's responsible? The doctor, the developer, the hospital.
Tough questions. Lots of work to do to make sure AI is used safely, ethically, and that it benefits everyone.
We do, but the benefits are so huge, it's worth it to face those challenges.
It's like we're entering a new era in medicine, and AI is going to be a big part of it.
It is, and it's exciting to be part of this, to see all these incredible innovations happening.
Okay, so we've covered a lot of ground today. HFOT basics, Areas for improvement. And AI.
And the ethics. Don't forget the ethics.
Right, of course, the ethics of AI in healthcare. But it feels like we've just scratched the surface.
We have, but I think this blog post has been a great jumping off point for this deep dive.
Absolutely. I bet our listeners are dying to hear more about these AI-powered devices.
I think they are. But first, a quick recap. Then we can dive into all those AI possibilities.
Sounds good. To sum it all up, HFOT is a promising therapy for respiratory failure. It's warmed, humidified oxygen at a high flow rate.
Right, and we talk about how research is ongoing, improving the monitoring, optimizing how it's delivered, and figuring out that humidification sweet spot.
We also talked about how HFOT devices can be different and how technology is leading to more sophisticated and personalized systems.
And of course, the potential for AI to totally revolutionize HFOT and, remembering to keep those ethical considerations in mind.
All right, so where do we go from here? What's next on our deep dive agenda?
I think it's time to dive headfirst into those AI applications, see how they could shape the future of HFOT.
Let's do it. Let's get a little sci-fi up in here.
Okay, so ready to explore those AI possibilities, like really dive in.
Oh, I'm ready. Hit me with those futuristic scenarios. Let's go full sci-fi.
Okay, picture this. Patient comes into the hospital, really struggling to breathe. Immediately, they get hooked up to an HFOT system.
Okay, got it. Pretty standard, right?
Yeah, but here's the twist. This isn't just any HFOT machine.
Yeah.
This one's got AI.
Oh, there we go.
It analyzes everything. Vital signs, medical history, even their genes, to see if they're predisposed to certain lung conditions.
Wow, it's like analyzing every breath. Super advanced.
Right. And based on what the AI sees, it fine-tunes the HFOT settings. Completely personalized therapy.
So no more doctors making manual adjustments. The AI's doing it all.
Exactly. And get this, it's not just reacting. This AI, it can predict complications, hours, even days in advance.
Hold up, predict complications. How?
It sees patterns, subtle patterns in the data that, we might miss. Like maybe a little increase in their breathing rate, a tiny change in their blood oxygen, or even just how they're coughing.
Those sound pretty small. Would we even notice those things?
Maybe not on their own. But the AI, it puts it all together, and it can see those tiny changes as early warning signs.
It's like a medical detective, finding those clues.
Exactly. And it doesn't stop there. It alerts the medical team, suggests what to do, even recommends changes to the HFOT settings, all to prevent the problem from even happening.
That's amazing, like a virtual assistant, working with the doctors and nurses, keeping everyone safe.
Exactly. And we're just getting started. This is just the beginning of what AI can do for HFOT.
Wait, there's more?
Oh, yeah. Remember how we talked about humidity? Finding that right level?
Right. Not too much, not too little.
AI can figure that out, too. It looks at everything. How moist their airways are, the temperature and humidity in the room, even how sensitive the patient is to dryness.
So it personalizes the humidity, too.
Exactly. It's not just about comfort, either. Remember, too much humidity can be bad. The AI makes sure the patient's getting enough oxygen without drying out their airways.
This is unbelievable. We've come so far.
All thanks to AI.
But doesn't this mean doctors and nurses aren't needed anymore if the AI is doing all the work?
That's a big question. Lots of debate about it. But here's the thing. AI isn't replacing anyone. It's helping them.
So like a super smart partner, not a replacement.
Exactly. AI can handle the data, the numbers, the constant watching, but doctors and nurses, they bring the human touch, the judgment, the empathy. That's what makes healthcare what it is.
Right. It's about caring for people,
Yeah.
not just data and algorithms.
Exactly. And that's something AI can't do, at least not yet. So even though we'll have these amazing AI-powered devices, human connection, still at the heart of it all,
I like that. AI and humans working together.
the perfect team. Now, remember those comments we talked about, matching the inspiratory demand with those HFOT flow rates?
Oh, right.
That one commenter, Stephen Tunnell, he was spot on. It's so important to make sure the patient's breathing and the machine are working together.
If the machine can't keep up, it could be dangerous.
Exactly. And this is where AI can really shine. Imagine an HFOT system that watches how the patient's breathing and changes the flow rate instantly to match.
So the machine's always one step ahead.
Right. Perfect partners. The AI makes sure everything's in sync, the right amount of oxygen, at the right time, no more guesswork.
That's incredible.
It is. And that's just one example of how we can use AI to solve those tricky HFOT problems.
So we've got AI helping with the monitoring, the humidity, even matching the patient's breathing. Anything else?
Oh, yeah. Remember how we said Not all HFOT devices are created equal. AI can help us pick the right one.
Really?
Think about it. A system that looks at all the patient's information, age, weight, medical history, how bad their breathing problems are,
Okay.
and then it recommends the best HFOT device for that patient.
So like a personalized recommendation.
Exactly. Make sure they're getting the best possible treatment.
So AI can help with everything. Picking the right device, personalizing the settings, predicting those complications.
It's true. That's why the author of that blog post was so passionate about this. We need more research, more development in this area.
High flow oxygen therapy. We need more. It's catchy. And it totally captures the excitement of all this.
It does. It's a call to action for everyone. Researchers, clinicians, tech companies, let's work together and unlock the power of AI for HFOT.
It's like they're saying, hey, we've only just scratched the surface. There's so much more to discover.
And it could change so many lives. All those people struggling to breathe.
I'm totally on board with that. AI-powered HFOT being the standard of care, helping people breathe easier, live longer, healthier.
That's the dream.
But before we get too carried away, we need to talk about ethics. Again, AI is amazing, but we've got to use it responsibly.
Absolutely. New technology, we've got to think about what it means ethically.
We've talked about fairness, bias, transparency, accountability when it comes to AI. Anything else, specifically for HFOT?
Well, what about over-reliance on AI? We don't want doctors and nurses to lose those critical thinking skills because they're so used to the AI doing the thinking for them.
Right, like relying on GPS too much. You might get there, but you don't learn anything along the way.
Exactly. AI should help people, not take over completely.
So it's finding that balance, AI and human expertise working together.
Right. And patient autonomy, too. Making sure patients understand how their data is being used by the AI and that they have a choice.
Right, not everyone's going to be comfortable with that. We need to be open about it. Let them decide.
Exactly. Give them the option to say no to AI if they want to.
Okay, so, wow, we've talked about a lot. AI-powered HFOT ethics. What a deep dive into respiratory care.
It has been. A lot for our listeners to think about.
Definitely. But before we finish up, I want to leave everyone with a final question, something to really chew on. Will AI-powered HFOT be the standard of care someday?
That's the million-dollar question. It's hard to say for sure, but I really think AI has the power to change everything about how we treat respiratory failure, HFOT included.
It's exciting to think about. A world where AI helps us deliver better care, more personal, more effective, and more compassionate for people who are struggling.
I can see it happening, and it's a future worth fighting for.
Well, on that note, I'll leave our listeners to ponder those possibilities. And before we go, thanks for being here with us today. Your expertise has been amazing.
Happy to be here. Thanks for having me.
So, wow, we really went deep on high-flow oxygen therapy, from how it works now to all those incredible AI possibilities in the future.
Yeah, it's been a wild ride, hasn't it? Exploring all the ins and outs of HFOT.
Totally. Let's do a quick recap for our listeners, the big takeaways from our deep dive.
Okay, sure. So, first things first. HFOT is a game changer for folks struggling with respiratory failure.
Yeah.
And it's not just about blasting them with more oxygen. It's about making sure that oxygen gets where it needs to go efficiently
Yeah.
and comfortably.
Right. Warmed, humidified oxygen at a higher flow rate. It makes a huge difference.
Huge. And the research, ongoing,
Yeah.
always evolving, looking at better ways to monitor, new ways to deliver the oxygen, finding that perfect humidity level. It's a constantly moving target.
And technology is playing a huge role. We've got smarter devices, and then there's AI. The potential to really personalize this therapy is incredible.
It is. Which brings us to our next big takeaway. AI could completely revolutionize HFOT. We talked about it analyzing all that patient data, predicting complications, even helping doctors make those tough decisions.
It's like having an AI guardian angel watching over the patient, making sure they're getting the best possible care.
That's a great way to put it. But of course, we can't forget those ethical considerations. Fairness, bias, transparency, accountability, all super important as we move forward with AI in healthcare.
It's a reminder that progress isn't just about shiny new tech. It's about using that tech responsibly.
Couldn't agree more. This deep dive shows why it's so important to stay informed and involved in the conversation. Because technology, it's changing the face of medicine.
It really is. Now, before we wrap things up, one final thought for our listeners. We've talked about the we need more part of HFOT, more research, more innovation. But what about the individual, the patient?
Ah, that's an interesting perspective. I like that. What are you thinking?
Well, we've been talking big picture stuff, advancements, technology, the future of the field. But what about the person who's actually experiencing respiratory distress? Right now, what can they do?
That's a really important point. While we're waiting for all these amazing advancements to, come to fruition, knowledge is power. Understanding HFOT, knowing what questions to ask their doctor, advocating for their needs, it can make a huge difference.
So don't be shy. Ask your doctor about HFOT, especially if you're having trouble breathing and regular oxygen isn't cutting it.
Yeah, exactly. Ask about the different types of masks, the monitoring they use, how they're going to personalize the therapy for you, and if you need to, get a second opinion.
Right. Be proactive. Be involved in your healthcare,
Yeah,
especially when it comes to, something as important as breathing.
I love that. I think that's a great message to end on. Empower yourself, advocate for yourself,
Mm.
and know that the future of respiratory care is bright, really bright.
It is. Well said. And to all our listeners out there, thanks for joining us for this deep dive into the world of high-flow oxygen therapy. We hope you learned something new today and that you're excited for what the future holds.
Until next time,
Yeah.
stay curious, folks, and keep exploring.
And as always, thanks for tuning in to the deep dive.